Yeah,
All
I'll
right, take it
try.
away.
Okay, so I'm really pleased to announce that Professor Tim McBride is speaking with us today. The title of his talk is The Long and Winding Road to Medicaid Expansion. This is such a timely topic that there are rallies going on right now all around the state about this, as we all know why. Tim is a Bernard Becker professor with the Brown School at Washington University. He's co-director for the Center for Health Economics and Policy Institute. Tim has a long background in being a health policy analyst and a health economist. This is what it said on Google, shaping the national agenda in health insurance, health reform, rural health care, Medicare, Medicaid policy, health economics, and access to health care. And currently, he's really zeroing in on Medicaid expansion. And I don't know if I mentioned he's co-director of the Center for Health, Economics, and Policy. Thank you for being here, Tim.
Thank you so much for inviting me. And I think can you make it possible for me to share my slides? Because I do have some slides, if that's okay.
That'd be great.
Yes, Pam is the host, and she is working on transferring you to make you the host so you can then share your slides. She's looking at that.
All right. Well, thanks for the kind introduction. And, you know, this is obviously a important time to be talking about Medicaid expansion. And it's unfortunately the news we got yesterday makes this as you said, a disappointing time, which I'll talk about in a minute. Up until that time, I was, you know, this has been a struggle to get Medicaid expanded in Missouri. And the reason, you know, I'm a Beatles fan, you know, I come from that generation. So I don't know if I've given probably 100 talks on this. I used to chair the MoHealthNet Oversight Committee from 2012 to 2019. I was appointed to that committee by Governor Nixon. I helped write his health policy platform when he ran for governor in 2008. In his thank you to me, I'm not sure it was a good thank you, but he named me to the MoHealthNet Oversight Committee, which I did for, was supposed to be a 3-year term, but I was on there for 7 years until Governor Parson removed me in 2019, which he had the right to do because my term was up. But I was chair for 7 years. I was actually on the committee for 9 years. So I've been at this Medicaid thing for a long time. And when Medicaid expansion passed in 2005, I thought about how long I've been thinking about this issue. And it goes back to even before Governor Nixon proposed Medicaid expansion in 2008 in his campaign, which I helped him write. So my first time I worked on Medicaid expansion in Missouri was 2005. So I've been at this for 16 years. So when I thought about that, then I thought about this title, Long and Winding Road, because it has been a long and winding road. And it's been a kind of a brutal road. And, you know, as you know, in Missouri, we were one of the last states that passed the expansion. And, you know, 38 states have gone before us. Sometimes people say we're the 38th. I like to say we're the 39th because I used to live in DC, and DC should be a state. So we're the 39th, including DC, and there are 12 left to go. And so we're the 39th state to expand Medicaid. We did it in an unusual way. Now only 2 states have done this. We actually voted to expand Medicaid through a voter initiative to put it in the Constitution. So other states have done this by passing voter initiatives to force the legislature to do it. most states that are light blue on this map did it right away through the legislature doing it. We did not do that. And as you know, Governor Nixon tried to push it through several times unsuccessfully. And the legislature just refused to pass Medicaid expansion. So several states, including states that would, sort of surprise people, Nebraska, Idaho, Montana, a few others, were able to pass ballot initiatives. So then people around the country said, well, maybe Missouri's ready to do it because we passed medical marijuana, we voted against right to work, we passed minimum wage, we did other things, sorry about the phone. And so maybe we were ready to do it. And of course we were, and we passed this 53-47. Some people say there was a narrow margin. I don't think it was. And, if you're walking around the state, I would suggest that you tell people it wasn't a narrow margin. I heard Claire McCaskill say in a purple state like ours, a 6-point margin is a landslide. So, and I think one of the reasons people said it was a narrow margin was because, and I watched this with, a lot of stress, and the night had passed, and most of the night it was behind. It was losing, it was losing, it was losing. And then all of a sudden it went over the top, mostly because of the votes from St. Louis region came in at the end, as they always do. And then it went from being behind by a couple points to being ahead by 53-47. So it won by 82,000 votes and 6.5 percentage points. And we can talk about the politics later if you want, but I want to sort of talk mostly about the policy. But, feel free to interrupt me at any point as we go along. I'm mostly going to talk about where we are right now, because I think that's what I was asked to do, and a little bit about why we're stuck again and where we're headed. Just I think it's always good to be grounded in what the policy does, should do. Once we pass Medicaid expansion, I'm going to tell you that I think we will get there in the long run. It's just going to take a few extra months. That's what people are telling me. So the amendment that's in the Constitution now expands Medicaid up to 138% of poverty. If you want to know what poverty is, it says on the bottom of that slide there. Poverty is about 13,000 for a single person, 22,000 for a family of 3. You do the math on that. That's not very much money. And if you're a family of 3, roughly, well, one thing I want to point out to you is our current level of eligibility for Medicaid for a custodial parent, like a single mother, is 21% of poverty, which is almost the lowest in the country. I think only Alabama is lower than us. That means that you have to have an income of about almost $5,000. And if your income is above that amount, you are not eligible for Medicaid. You are also not eligible for Medicaid if you are a single person, regardless of your income. You could be at 0. You would not be eligible for Medicaid, or if you're a married couple. You can get Medicaid if you're an income person that's over 65, or if you have disabilities at a higher income level, and if you're child up to 300% of poverty. But basically, if you're under 65, forget it, unless you're extremely low income. And that's what this policy is aimed at doing. So we have this sort of gap population, if you want to sort of see it, between like 100% of poverty and 21% of poverty. That's really, this is really aimed at. And furthermore, as the first bullet points out, the main incentive for doing this is when we enroll somebody now in Medicaid, the federal government pays 65%, the state pays 35%. It's roughly, a third and 2/3. But under expansion, the state will only pay 10%, and we'll pay, and the federal government will pay 90%. So that's huge, because that's a pretty big difference between paying 35% and 10%. So again, stop me if you have any questions about all that. So that's sort of the basic. Yeah, go ahead. I see a hand raised.
I have, when under expansion, will the 90% 10 go for everybody that's currently on Medicaid too, or the only newly covered people?
Great question. No, it's only for the newly covered people. So there are about 1 million people on Medicaid right now in a state of about 6 million people, which is a lot. But so this would apply only to the roughly 275,000 people that would enroll under Medicaid expansion. Great question. Thank you. Just raise your hand or reveal yourself and yell at me. I got 2 screens here, so I'm looking at one. Just go wave at me or something. so that worked. So what does the amendment do? It's really quite simple. You know, the people who set up the amendment made it as simple as possible. And so that you couldn't get into trouble, but obviously we did get into trouble along the way. They said they didn't make it. They said a simple expansion up to 138% of poverty, put it in the state constitution so the legislature can't mess it up. Of course they did, but and the governor has to do it. And the only other things it requires is this: they have to do 2 things. They have to file what's called a state plan amendment, which tells the CMS, as it's called, the Center for Medicare and Medicaid Services, on March 1st, we're going to do this, and they're going to say how we're going to do it. The state did that. They filed that state plan amendment on time, March 1st. I've been told, just to be fair and balanced, that the Medicaid oversight, MoHealthNet, DSS worked really hard to implement this. Everything I had been told up until yesterday was that they were doing everything to be ready for this, which gave me a lot of encouragement. You know, people said, you know, don't worry. But the people have spoken and I will implement it. We'll get to what he said yesterday in a minute. But so he, so, you know, so, but, there's somebody that wants to be admitted. So should I admit them, or maybe you could admit them? So, now that I'm a host, am I the only host?
Please
Okay.
do.
Yeah, I'll admit them. So, and so the only other thing it's supposed to do is July 1st, people are supposed to be enrolled who are entitled to be enrolled. Well, obviously what happened yesterday was the governor, had submitted this thing called the state plan amendment, which is a bureaucratic document. It had gone to CMS. They were, from what I had heard, I saw a draft of it. I think it was almost ready to be approved. The governor wrote a letter and said, I'm withdrawing that agreement with Medicare and Medicaid because the legislature is no longer funding this, so we don't have the funding, and so we cannot do this. That was, frankly, a surprise, at least to me. Some people had said they thought this is possible, that this could happen, but frankly, I woke up this yesterday morning, got an email, and I was like, oh my God, okay. I'll get to what's going on in the legislature in the next couple slides. But so we are now at a place where it's 100% certain it's going to the courts. It was 100% certain it's going to the courts anyways. It was just a question of which side was going to take it to the courts. Now it means that the proponents are going to take it to the courts. What is likely was that if we had opened July 1st, somebody enrolled, the opponents of Medicaid expansion were going to file a suit against it and try to stop it. That's what we thought was going to happen. Somebody else wants to be admitted. I'll admit them if that's okay. William Miller. So, and so, so we thought for sure there was going to be a lawsuit. Now we know for sure it's going to be a lawsuit. It's going to be filed by the proponents. So here's kind of what happened in the legislative process in the next 2 slides. Governor Parson gave a state of the state address, which was dramatic in other ways, but I won't get to that. But he announced his budget and he said, you know, one thing that surprised people, because the opponents said we can't afford Medicaid, and if we do Medicaid expansion, it's going to, like, you know, be, you know, all hell is going to break loose, and we're going to cut education, roads, prisons. You know, you heard all that. Well, he announced that his budget, it was going to cost money and it was going to be expensive, but it wasn't going to crowd out spending in any other area. That's what his budget director said. That's what I haven't read here. It would not cause some of the crowding out issues. That was important because he basically, in my mind, took the air out of the balloon of all the critics. He said, we can afford this $130 million. It's expensive, but we can afford it without cutting education, roads, prisons, whatever. And furthermore, he said, I was against it, but I thought it was my obligation as governor to try to get it implemented. Also important. He said, we should do this. So, so what was in his budget? He said it was going to cover 274,000 people. It was going to cost $1.6 billion, a lot of money, but of course, federal government's going to pay 90% of that, which meant the state was going to have to come up with $130 million. I personally don't agree with that number. I will tell you that our center estimated what this would cost, and that estimate was used as the basis for the ballot initiative. It was used by the state auditor, and our estimate is pretty controversial. We can talk about that if you want. I think this number should be closer to 0, but the governor doesn't agree with that. Reasonable people can disagree. I think in the long run, when this is implemented, this number is going to be closer to 0, but they don't believe that. So, you know, we can fight over numbers if we want. $130 million is not a huge number when you're talking about $2 billion, to be honest, and it's sort of almost rounding error. Here's the most important thing on this slide, though. So the state government has to expend $130 million in general revenue, but after President Biden was elected, he pushed through the American Rescue Plan, and they pushed it through and got it passed through reconciliation. And that includes an incentive to that if states decide to expand Medicaid who have not expanded Medicaid, that includes Missouri, because we still have not expanded Medicaid. Not yet. We voted to, but we haven't done it yet. They get an extra 5 percentage points on their matching fund, which, if you do the math on that, it's 1.15 billion with a B, not million, with a B, over 2 years. 1.15 billion. This gets hardly ever mentioned, and it was not included in the governor's budget. So you do the math on this, you don't have to, you can use grade school math on this one. You know, 1.15 billion should cover the cost of this for about 10 years, maybe 8 if it rises for a while. You can put the 1.15 billion in the bank, draw out 130 million this year, draw out another 130 million next year, keep doing this, and maybe after 8 to 10 years, you've covered all the general revenue costs for you know, most of 10 years. That's pretty darn good news. And that was the whole point of the Biden administration doing this. They really wanted to encourage states to expand Medicaid. It's actually better than that. The news is even better than that, because this isn't good news that we're in the middle of a COVID pandemic, but they also expanded the funding for Medicaid, the current enrollees, to get to Sue's point, the current enrollees by another 6 percentage points to cover the costs of people on Medicaid, that amounts to $400 million. Okay. So the state is poised to get somewhere between 1.5 and some people think it's as much as $2 billion if we expand Medicaid. 2 billion. So put that in context with the legislature saying we cannot afford to expand Medicaid, which is what you heard all legislative session. We have so much money. You all have lived in Missouri probably most of your lives. I've lived here for 30 years. The next sentence is something I've never said in 30 years. We have so much money in the Missouri budget this year. I have never seen it in all my career. The governor started with $1 billion in the bank. He started with $1 billion surplus. And then you have another $400 million from the COVID relief fund. And then he can get $1 billion if he expands Medicaid. And then there's more and more and more. I could keep going. But so the thought that you can't afford to expand Medicaid is frankly absurd. Okay. So despite all that, here's what they did. The House Budget Committee said, we're not going to expand Medicaid. We can't afford it. We're going to take Medicaid out of the bill and we're going to put it in a separate bill. When we saw that happen, we knew what was going to happen. They voted that separate bill down on a party line vote. The Democrats tried to revive it on the floor. They don't have the votes to revive it. It didn't survive on the House. It went to the Senate. There were rumors that the Senate would revive Medicaid expansion. And, I kept on hearing, well, there might be enough senators to do this, including Caleb Roden, who, as you know, made a pretty courageous speech at the end of the debate. But in the end, that didn't happen. The Senate also voted Medicaid expansion down. And so the House and the Senate both voted down Medicaid expansion. I think it was really kind of a game of chicken. They were basically saying, we're not going to do it, Governor, you do it. We think you should bite the bullet and fund expansion. We don't want to be blamed for doing this. I will also tell you that I think one thing that I've heard happened was Senator Blunt retired. And there are probably about 20 people in the state that think they're running for senator, including some of the people in the legislature. And they do not want to have a vote for Medicaid expansion on their record. And if that had not happened, this might have passed. That's the politics of it. In any case, it went to the governor. Many people thought the governor might put the money into the budget, but obviously he didn't. We also thought that what he might do is do what looked like was going to happen until yesterday, which was let the state plan amendment go forward, let people enroll on July 1st, and then all of a sudden Medicaid would start running out of money. I can tell you, as chair of the Mo Health Net Oversight Committee for 9 years, what happened was they would under budget Medicaid every year. And then about September, October, we'd have another meeting and they'd come and they'd say, oh my gosh, we under budgeted Medicaid. We need a supplemental bill to raise more spending for Medicaid. We need another $200 or $300 million. And I'm an economist, so when they originally passed the budget, I'd say you're under budgeting Medicaid. I know it's too little. I can look at the numbers. I know you're under budgeting Medicaid. And they said, oh, no, we're not. Oh, no, we're not. And then they come back and I say, I told you so. And it was the one time that Senator Schaaf, who you probably know, famous Senator. He and I would agree on this all the time. So, and then when we came back, we said, we told you so. And what people thought would happen is they would come back later and pass a supplemental. Anyways, that's not going to happen. So now we're going to head to court. That's where we are right now. So that's sort of the political machinations. Yeah, okay, there's a chat question in the chat. Let me see if I can deal with that, because this is a good. So David says the majority party in our legislature is ideologically opposed to cooperating with the federal government to bring Medicaid to poor people. They will block Medicaid expansion. They do not care how much money this costs us. They'll pay more in court costs to keep it from happening. That's what their position is, and they're sticking to it. You know, I think there's a lot of truth in that statement. Many people have asked me for years why we've not passed Medicaid expansion. And, you know, the numbers just don't line up. It doesn't make any sense. As I just told you, you know, there's no budgetary reason why we shouldn't do this. And there's no sort of justification on a healthcare reason, which I can show you in the next few slides.
Tim?
Yeah, and there's no, the only possible reason you can do it, you can make for it is ideological. I'm opposed to the role of government being expanded, and that's the only thing you really hear from the other side. And the only other one I can tell you is Obamacare. It's Obamacare, it's Obamacare, it's Obamacare, and you know what that's about. So,
Yeah, I have a question.
Yeah.
I've heard from opponents of Medicaid expansion that the 90-10 split is only applies to the first year, and that after that the state's portion would go up. And so they're saying, just quoting this 90-10 split is a smokescreen, that the Democrats are just talking about that, but that the next years it costs more and more and more. Would you address that?
I went over and testified on the legislature on that question. That question was asked by a legislator. Here's the actual legal answer to that question. That 90-10 split is actually in the Affordable Care Act legislation. I've read that legislation. I'm probably one of the 20 people in the whole country have read all the 2,700 pages. And so it was passed and it's in the legislation. So, and it's in that legislation in perpetuity. It'll be there forever. So if you want to argue that the 90-10 is going to go away, it needs an act of Congress. Okay, so now how many times did they try to pass a repeal of the Affordable Care Act? Over 60 times. How many times were they successful in repealing the Affordable Care Act? 0 times. And you know what, Senator McCain did. And so I predicted that they would never repeal the Affordable Care Act, and they never did. So my answer to you, David, is you would have to pass a law to repeal that. And that would be as hard as it was to repeal the Affordable Care Act. So that's in there for perpetuity. Does that answer your question?
Where are they coming with this number that it's going to be going down? Where does that come from?
A lot of people just don't understand healthcare policy. They don't understand this law. It's a very complicated law. It's 2,700 pages long. And there's a lot of misinformation. The amount of misinformation that I've had to deal with in dealing with this is, you wouldn't believe. You would probably believe, but there's an incredible amount of misinformation, and it's peddled by people that either are, intend to do that or don't intend to do it. That's my most charitable way of putting it.
If I could add to that, there was a period of time at the very beginning when the
Yes.
federal share was even higher.
Exactly.
Ratcheted it down to 90%. I think that gave people the some people the impression that it was going to continue to ratchet down, but 90%.
Yeah, it was 100% for, I believe, 2 or 3 years. Then it went to 95, then it went to 90. And so, you know, we gave up on those years when we could have paid zero and expanded Medicaid. Then we could have done it when it was 5% of the cost. And now we're in the 10% of the cost. But it's that way forever now. You know, so it's kind of mind-boggling. Is there another question in the chat? A couple of questions in the chat. Are we seeing pushback on the General Assembly that continues to reject the people's will? Clearly, you know, this is just another ignoring of voter initiatives. And now what I think we're seeing is they're I think because they were so mad that the Medicaid expansion passed, they're now looking to make sure that voter initiatives require 60% vote. I think that's what that's about. Do you have any information on the current and ongoing status of the Medicaid managed care in MoHealthNet? Senator Rob Schaaf, who actually, he and I became good friends after fighting a lot on the committee. So, and he was an interesting character and still is, was an opponent of the managed care and the oversight committee and was supposed to be monitoring this. He and I really asked a lot of tough questions on this when I was on the oversight committee with him. And a smart guy, but he had two passions. He really did not like managed care and he really did not like hospitals. And he asked a lot of good questions about managed care, and some of his questions, and frankly, all of his questions were good. Sometimes his biases were extreme. But, you know, frankly, I think there's still a lot of really good questions that could be asked about managed care. And, you know, to be fair and balanced about it, I would say that we, you know, the truth of the matter is our state is extremely understaffed almost everything because we're such a low tax state, and we understaff MoHealthNet. And so we do not have enough oversight over managed care. And almost every state in the country has done this sort of simplistic thing, which is, oh, you know, we could save a lot of money by farming out healthcare costs to managed care companies. We're going to save a lot of money. But in fact, that only works if you actually monitor what they're doing. And you have to really watch what they're doing like hawks. And I'm agnostic on this question, I will tell you, because I think sometimes managed care can do good things, but sometimes, I mean, you got to watch them. And, you know, they're for-profit companies, and you have to make sure their profits are minimal, because the profits are coming out of the money that we give them. So you got to make sure that they give good quality care and access to care. And, you know, we're not doing that. To answer the question from Steve, that's a very good question. So, and the important thing about that question there's a lot in that question. I could talk about this for like 3 hours. But we're going to, when we expand Medicaid, those 274,000 people are going to go into managed care. So we have to be, almost everybody believes that. And you are all in Boone County, I assume, or close to it. And one of the things that we're doing a study of, I've been on a grant funded by Missouri Foundation for Health, and we've done pretty much since the Medicaid expansion was passed, we've been doing a lot of research, which, you know, we can cover whatever, I can talk about whatever you want, but what I was going to talk about next was some of the research that we've done about expansion. And we've been looking at some of these things, like how many people will enroll, what are the demographic characteristics, what are the health characteristics of the enrollees, what's their current access to care, what's their potential pent-up demand, will the providers be available to provide care to them. And we have I have a colleague, Sydney Watson, who's on this project with me, and she's been looking at the managed care question, and is there network adequacy available to the to people. Like it's, it's frankly pretty good in St. Louis. It's probably okay in Kansas City. But once you get out into the Northeast Missouri and into the Ozarks, and frankly, even around Boone County, she has found that University of Missouri Hospital does not contract with some of the managed care plans. I'm not exactly sure why not, but so it's an important question. Is that does that answer your question, Steve? It was a very good question. What are the legal arguments on both sides of the impending court case? Really good question. So I've been on many phone calls where that question's been asked, and I'm mostly on the calls where, as you can expect, in favor of expansion. I'm not invited to the calls where I'm opposed to expansion, but I know what the arguments are on both sides. And they say don't talk about what the arguments are, because if you're a lawyer, and if there's any lawyers on the screen right now, they say the last thing you want to do is give up your arguments before the case and in public. But I think basically there were two cases that were filed before the ballot initiative went out to try to stop it before it even went on the ballot, and they both failed. And I think they will bring the same arguments up this time. And both of the times it failed was for various reasons, but the judges basically said you don't have standing to, I'm not a lawyer, so I'm probably going to get all the jargon wrong on this, but you don't have standing to bring this case because no harm's been, nothing's happened basically. So the people who are filing the case basically said the state's going to be harmed and the taxpayers are going to be harmed, and they said, well, nothing's happened, so how could you file this case? so now they think they're going to bring the same arguments forward and said, okay, now this expansion is going to happen and there will be harm to the budget, and so they that's, and I think their basic argument, one of the things we heard repeatedly in the last few weeks, was that the ballot initiative itself was unconstitutional because it didn't have a revenue source. So as you know, when you voted for it, if you paid attention, and they also argue that people didn't pay attention, but I think they did. The ballot initiative said, are you in favor of expansion? But it didn't say, and the tax source is. The reason it didn't say there was a tax source is because it basically said it didn't need one. And that was because the auditor did a fiscal analysis that said that one was not needed. Because it basically said that Medicaid expansion would be budget neutral, that the general revenue costs would be offset by the savings. Now, I will tell you, to be forthcoming, that she based most of her analysis on our center's analysis, because we did an analysis funded by the Missouri Foundation for Health, which concluded that. We concluded that basically the Medicaid expansion would be budget neutral. So, and a lot of people on the other side don't agree with that. And as you can tell, the governor's budget didn't agree with it. They concluded that it would cost $130 million. Their initial estimate was 200, so I was at least pleased they came down from 200 to 130. But we concluded that the state would save $40 million. So that's one of the biggest arguments on the one side. I think there'll be other arguments. On the proponent side, I think their main argument is going to be the voters voted for it. It's in the Constitution, so therefore it should happen. And so it's now a constitutional right, and you got to do it. I think it's almost as simple as that. And I'm not sure there's much else to be said about that. Does that make sense? Any other questions about that? I can just keep motoring along. I know I got about, are we going into about 1:15? Is that right?
Correct. Yes.
Yep.
Thank you.
Yeah. So I'll go through a few other things, and then, I love the firing the questions as I go along. I'm a professor, so this is dynamic and I like to do it this way. So just keep asking questions as I go along, and I'll just talk about whatever you want me to talk about. So again, we've been looking since this past at implementation, what this means, and I'll give you a flavor of this. And here's the website. We've posted a lot of this analysis, so you can look at it if you're internet savvy, or maybe Alice or others can help you with this if you want to send it around. So here's what we conclude. Well, the governor has estimated 274,000 people would be covered. We conclude that about 60% of those people are currently uninsured, so they have no health insurance. About 40% are have some form of insurance. About 30% are in private plans. Most of those are people that are in marketplace plans, the so-called Obamacare marketplace plans. So those are people between 100 and 138% of poverty that are getting subsidized marketplace plans. The law says, and it would be just logical for them to go into Medicaid because it's free. And I think they would be required, my understanding is they would be required to go into Medicaid. And in every other state they go into Medicaid. There are a few people that we believe that would leave their employer-based plan and go into Medicaid. These would be probably very low-income part-time workers. This is kind of, maybe you can think about it as sort of quote unquote the Walmart effect. People that have low-wage jobs might have insurance because their employer is big enough to offer it, but they might be paying something out of pocket, and then they might just say, "Oh yeah, I'm going to go get Medicaid," and because it might be a little better for them to do so. It's not a really big number, but it's some people, and the legislature, I can tell you, fixated on this. Some of the conservatives, the so-called conservative caucus, they were like, well, this is not going to help anybody because they're shifting from one form of insurance to another. But I view it, frankly, as an economist, as saying these people are probably going to be better off because they're now paying out of pocket something, and they'll get better. They'll now pay less out of pocket. So it's a different, you have to think about it through their lens. If you're making $10,000 a year and you're paying out of pocket for healthcare, and you're going to go into Medicaid and you're going to pay zero, that's a good thing. But that's not how they view it. Anyways, so I'm pretty passionate about this, as you can imagine. And as Carl or Mari says, many employer plans have very high deductibles. So that's exactly right. And many of those marketplace plans, I've studied this for years, have $5,000 deductibles, $6,000, $7,000 deductibles. So even though you may be paying a $20 per month premium or zero premium, you got a $5,000 deductible, and you'll be better off in a Medicaid plan. Even though we can beat up on Medicaid all we want. So one thing that I think is really notable is we did an analysis, I did this, of the geographic distribution of where the Medicaid enrollees we project, this is an estimate of where they will be across the state. This is sort of in the 13 census regions. I actually did it by county, and it's being used quite a bit. As I understand, if you go to our website, you can look at a county-based map and see county by county where they are. And if you want to beat up on your state legislator or senator, you can say, there are 800 people in your district that you're going to cover and you didn't vote. So just a hint. So one thing I want to point out to you, if you look at this map, lighter colors is a lower percentage of the population that'll be covered by Medicaid. Darker is a higher percentage. Now, one thing to note about this is it might surprise people. The lowest percentage is in the St. Louis region, central region, including Boone, Kansas City. The highest percentage is in the Ozarks. That might surprise people. So the highest percentages are in the rural areas. Interesting. Rural people voted against Medicaid. Urban people voted for it. So why is the rural percentage higher than the urban? Well, I'm sitting here in West County, St. Louis, around, Ladue, probably one of the highest income parts of the state. We have the lowest uninsured rate in the whole state, probably. It's probably 2%, 3%. Very few people are going to sign up for Medicaid in my zip code. But there's a lot of uninsured people in the Boot Heel. There's a lot of uninsured people in the Ozarks. And though their legislators don't want to talk about it, that's where they're going to come from. And those hospitals are in trouble. 7 hospitals closed down here in the southern parts of Missouri, as Governor Nixon used to say. And that's where the trouble is. And there's a lot of uninsured people in the northeast part of the state. And they've been struggling quite a bit. So that's one of the reasons we did this map. And anyways, that is something worth noting. A few other things that we found in these, there's a lot more details about this in our policy briefs we put out. Over half of the adult expansion group is going to enroll in the first 2 months. This surprised me, actually. When we looked at the most recent 5 states that have expanded Medicaid, most of the people enrolled right away. We estimate 150,000 people, and so does the governor, will enroll in the first 2 months. These people really want this coverage. As I mentioned, while the greatest number of people live in urban areas, the higher proportion will be in rural areas. 1/3 of the state lives in rural areas, but 41% of the enrollees will be in rural areas. The new expansion enrollees will be younger, less than 45 years old than the current Medicaid enrollees. Remember that the current Medicaid enrollees tend to be aged, blind, disabled for the most part, and a few single mothers, and then a lot of kids. This group is going to be single males, single females, married couples, low-income people that don't have access to medical care. And so it'll be 18 to 45-year-olds, and they will tend to be healthier than the current Medicaid enrollees. Again, the current Medicaid enrollees, as Steve knows, she told me, reminded me he was part of Mo HealthNet. I remember, my friend. So, so he was, the current Medicaid enrollees tend to have a lot of chronic disease. We did a lot of analysis of what these people look like. They do have some chronic disease. They're going to come in with asthma, with some diabetes. They're going to come in with heart disease, but they don't look as sick as the current Medicaid enrollees. So we need to worry about them as they come in. They're going to come in with some needs, especially because they're going to have pent up demands, but they're definitely not going to look as sick as the current Medicaid enrollees. Does that make sense? I'm talking fast here, so stop me if you have questions about this. Any questions about this? I mean, the reason this is important is we did this analysis because the state, I went in and testified before Medicaid expansion happened. And I was sort of blown away because they predicted that the new enrollees in Medicaid would be more expensive than the current Medicaid enrollees. Steve's shaking his head no. So, and I was sitting there going, and they hired an outside consultant, and it was the first time I saw the number, and it was like $700 a month, and I was like, no, I don't believe it. And they said, why don't you believe it? And I said, well, the people are going to enroll are going to be working. They're going to be younger. They're not on Medicaid because if they were sick and not working, they would already be on Medicaid. And so I don't believe that they're going to cost $700 a month, which is like $8,000 a year. They're going to cost less than the current Medicaid enrollees. And so I think they ginned up that number, frankly. I don't know. Let me retract that statement because I don't want to say they did that. I don't know. This is where you can have a healthy disagreement over a number. I just don't believe that number. I'll just put it that way. The proof will be in the pudding after we expand Medicaid, but I believe that number will be less than the current Medicaid enrollees. Does that make sense? That's why it's really important to look at their age, whether they're working or not, I mean, these are people that 70% of them have a job. Okay. So you got young people, they have a job. So they're going to work already. Can they be disabled and sick? They might be a bit, or they might have some, but they're not disabled enough to already be in Medicaid. See my point? I think this is a pretty important point because it gets to how much this is going to cost the state. So here's a couple of, go ahead. Yeah, somebody.
There's a question in the chat.
Oh, is there a question? Oh, Kathy says, do you have any insights to why the HELP expansion would, oh, thank you. Yeah, this is an important point. Why the expansion would, how the expansion would help rural hospitals and why does it not appeal to legislators in those areas? That's a good question. Because, you know, one of the things that's surprised me over the years is even going back to Governor Nixon when he proposed this, he did everything he could to put together the coalition. He went and got every chamber of commerce in the state. He got the Missouri Hospital Association. And I've gone around and talked to the CEOs of these hospitals, and if you have, they're not liberals. So I've talked to some and they'll go, look, I'm not in favor of Obamacare, but I'm in favor of Medicaid expansion. And, these are people that are head of hospitals that have 25 beds, and so they know it'll help them. And so there's just a disconnect that happens, I think, when you have a hospital in your district that's got 25 or 50 beds, that they know that it's going to help them. And they're probably telling their legislator it's going to help them. And they still won't do it. Again, I think it's ideology. I think it's pressure from their voters and whatever it is. But it's pretty clear to me. I've done rural health research for over 30 years. This will help rural hospitals who are really in, frankly, the worst shape that I've seen them in my entire career. We've lost 7 or more rural hospitals in this state. And there's a strong correlation between losing a hospital and being in a non-expansion state. It's not the only reason why they close, by far. It's not the only reason why, but it certainly doesn't help. And if you expand Medicaid, what it does is raise your payment for those low-income patients by a few percentage points. And think about it. Hospitals operate at very low margins. People are surprised by this. They operate at between, less than 5% margins one way or the other, between -5% and +5%. So a rural hospital that's constantly -3%, -3%, their board of directors is the bank and the realtors and whatever, and they're running at -3%, they're going to say, you got to close your doors. And all of a sudden the state expands Medicaid and they say, okay, that -3% is now 0 or +1. They'll say, okay, you can stay open. That's the difference. I can tell you that BJC in our state, in St. Louis, you know, their margin's not huge, but their revenues are huge. So, you know, so they don't, you know, they'll be helped by Medicaid expansion, and Senator Schaaf complained about that all the time. But they, you know, that's the difference for a rural hospital. But I don't really get why the legislators don't get this, and why they don't listen to them. Other than ideology, I just can't really explain it. I don't know, maybe Steve's got an answer, maybe somebody else does, but I, so, you know, I'll skip these slides. We're also mapping out provider capacity. We're a little wondering about, are there enough providers to take, you know, this is a little bit of the hand wringing that's going on, you know, 274,000 increase in Medicaid expansion is, you know, if you think about it, a 25 to 30% increase in Medicaid enrollment in the state. And then you put it in those numbers, people started to freak out a little bit. And people said, well, okay, can we handle that? And as if those of you who know Medicaid know that a lot of providers don't like to take Medicaid recipients for whatever reason, we can talk about that. So we've been mapping out where the healthcare professionals are in the state, and there are shortage areas. I won't talk about it unless you want me to talk about it, but I can tell you the biggest concerns we have are probably dentists and mental health professionals. We have pretty severe shortages of dentists and mental health professionals in certain parts of the state. And I think the biggest places where we have concerns are the northeast part of the state and probably the southeast part of the state. Not St. Louis, not Kansas City. For the most part, probably not near you. But I will also tell you that I think, remember that 150,000 of these people are uninsured, but the other 120,000 people are currently getting medical care because they have marketplace plans, they have employer-based plans, so they already have medical care. It's the 150,000 uninsured that are gonna hit the healthcare system, and they may immediately start going to get healthcare, and they maybe haven't had it in years or maybe never in their life. And that may be the sort of stress on the system in the first 6 to 10 months, because what's their usual source of care? The emergency room, or they don't usually use it. So that's probably what we need to be worried about. And the one we talked about earlier is, do the Medicaid managed care companies have adequate networks to take them? Because we're going to dump 275,000 people in the Medicaid managed care companies. When I'm slipping, what I want to say to people is say, it's not the state's problem. It's the managed care company's problem, because we're going to give them $2 billion and we should be turning it on them to say, it's your problem. We're going to give you $2 billion, you fix it. And I frankly think that's what we should do, but nobody's going to do that. If I were still in charge of the oversight committee, that's what I would do. But, I'm not in charge. So the final thing I will say is, and I never was in charge, as Steve knows, but the economic effects of the Medicaid expansion, we were not allowed to actually answer this question when we answered it as part of the Medicaid analysis we did, but because a lot of people don't believe these numbers, but I believe it'll have a pretty significant positive economic effect. Think about this way. The federal government's going to drop about $2 billion on the state that it's not been doing. It's been sending it to California and Colorado and Illinois. And but the Missouri Foundation for Health did pay eventually for somebody to do this analysis. They concluded it would create about 16,000 jobs, most of those outside of Kansas City and St. Louis, and they would be high quality jobs earning over $15 per hour. And that $1 billion, $1 to $2 billion would generate even more state revenue than that. or even more GDP or state GDP than that, which also would lead to state personal income tax. That number is not even in the governor's budget. Governor Nixon estimated that that would generate another $100 million to the state. So that's another 100 million we're not even counting. So that's, I'm done for now, and I think we're almost out of time. I'm sorry. I talked a lot, but we were answering questions as we go.
Good timings, Tim.
Yeah.
Anyone else still have a question? I guess we're about done. You're right.
I'm sorry. I like to talk, as you can tell. So
It was great. Thank
We're
you,
glad.
Tim.
Yes,
what's that?
You did an excellent job, Tim. Thank you very much. So, this time is up. What we'll do, we'll officially close the meeting, but if Tim has minutes, if he wants to stick around and answer other questions, then feel free to stick around and maybe we can do some more chatting. I'm going to have to slip out because I work at the Democratic office this afternoon. So I'm going to slip away. But again, Tim, thank you very much for being here and explaining and going over that with us. And anyone who wants to stick around and chat with him, feel free. And I'll see the rest of y'all next week. Thanks a lot. Good job, Tim.
Thank
Oh,
you.
thanks. Yeah.
Thank you. That